opinion, is there or is there not a healthcare crisis in Nova Scotia?
Do I believe there's a crisis? No. I believe there are challenges in the healthcare system.
Do you think there's a crisis?
Yes, there is a crisis. Because you see it every day.
That's why this is a crisis. It's not just a family doctor crisis, it's an emergency care crisis, and Cape Breton is showing that.
It's difficult to address the health crisis in Cape Breton if our elected officials or our health authority will not actually admit that there is a health crisis. No, we haven't hit the bottom yet. It's going to get worse. Are people going to die because I'm leaving Cape Breton?
We get some help in here? Room 404?
Yeah. My name is Dr. Bernie MacIntosh. I'm a family physician. I'm originally from Sydney Mines, and when my brother and I started to get into trouble, the parents decided to move us out to the country, out to Big Breton. When I came back, I was fortunate enough to get one of the family medicine residency spots in Sydney. It's kind of like winning the lottery. After the residency program, I was able to stay in the area, in the north side area, and open up my own family practice. So I've been in Little Breton operating this clinic for the last 4 years. The clinic came to be in response to the Northside ER being closed every day at 3 p.m. I could offer a walk-in clinic service 2 nights of the week, and that way people don't have to drive to the Sydney Regional ER or the walk-in clinic. That would be great. The current bureaucracy of the health authority prevents the young physicians or young professionals coming and being innovative, trying new things. Yeah, I was just trying to provide access to healthcare. I was an independent physician. It was within my ability. Why not? The message I have consistently received from the health authority is that your clinic is not wanted. You need to move on. Unfortunately, this unique avenue for accessing care is no longer going to be available. And it seemed like a good idea. Community loved it, but unfortunately it ruffled some feathers within the former Cape Breton District Health Authority.
So you're leaving?
I'm leaving Cape Breton, yes.
How does that make you feel?
A little bit angry. Maybe it was naive to think that I could go home and run a practice and raise a family in the same environment that I grew up in. But when I stop and think and look at the big picture, the issues in Cape Breton and Nova Scotia are so big that an individual is not going to change them. Behavior of senior physicians as well as senior administration, I believe I've been forced to leave Cape Breton.
Do you think anybody would argue with you over that?
Of course they're going to argue about it. The same way they're going to argue that Cape Breton doesn't need vascular surgery. We met in undergrad, and the plan was go back to Cape Breton and raise a family. We are blessed with 4 healthy, happy children. We have 3 girls and then the boy. And we've been having a blast as a family. It's super odd that a young doc cannot come back to their home community and not be able to contribute to their hometown as a family physician. The best thing I can do right now is to look after my family, and unfortunately that means leaving the Cape Breton area. I would not support the McNeil Liberal government this election. Reason being his refusal to acknowledge there's a healthcare crisis in this province. And that's why I will not be supporting the McNeil government. It's irresponsible to have what's happening in Nova Scotia and say, well, there's no healthcare crisis and that everything's okay. He let me in. It's just, I have a hard time swallowing that.